So the Philippine Nurses Association of New York was established in 1929, and the organization aims to uphold a positive image and foster the welfare of Filipino American nurses in the state of New York. One of the main thrusts of the association is providing community service through a synergistic partnership with various professional and community organizations. So PNA-NY initiates community outreach activities and participates in various community affairs that enhance the health and well-being of the community that we serve.
The mission of the Department of Health Bureau of Tuberculosis Control is to prevent the spread of tuberculosis and eliminate it as a public health problem in New York City.
PNA-NY is focused on the different boroughs of New York City. So we work closely with the community organizations and also with the Department of Health in Queens, Brooklyn, Staten Island. But in this particular project, we spend a lot of time in terms of serving the residents of Queens.
The New York City has the highest burden of tuberculosis cases of any big city in the United States, and one of the highest rates of TB nationally. Tuberculosis disproportionately affects foreign-born New Yorkers, with 82% of all TB patients in 2015 born outside the United States. With a goal of further reducing TB among high-risk foreign-born communities living in New York City, the Bureau of TB Control proposes to work collaboratively with non-Department of Health healthcare providers and communities to prevent tuberculosis disease. This project proposes a community-based approach to identify and evaluate Filipinos at high risk for LTBI and or progression to TB disease who might not otherwise seek evaluation. This project includes health education, enhanced targeted testing, and LTBI treatment using the short course regimen. With the help of Filipino healthcare providers and a Filipino patient navigator, we seek to increase knowledge of LTBI to reduce barriers to TB-related healthcare services, increase TB awareness, screen high-risk individuals, ensure medical evaluation, and LTBI treatment. A Filipino patient navigator is a trusted member of the community that can serve as a link between the community and health services. Having a Filipino patient navigator who speaks the language will facilitate access to services and improve the quality and cultural competence of service delivery that this project aims. So the goal of this project is to increase the number of Filipinos evaluated and treated for LTBI. The objective is to assess the impact of a culturally and linguistically appropriate patient navigator in increasing LTBI evaluation, treatment initiation, and completion of treatment among Filipinos. In 2014 to 2015, Philippines ranked 4th among 10 countries with high number of cases. In 2016, the Bureau of TB Control Outreach Unit started partnership with the Philippine Nurses Association of New York on TB outreach activities. TB education sessions and free TB screening using the blood-based test QFT were conducted to Filipinos in Queens. With our continuous partnership, in 2020, Philippines still ranked 7th among 10 countries with high cases of TB. But it is hoped that pairing culturally and linguistically competent patient navigators with Filipino clients will encourage TB evaluation and increase initiation and completion of LTBI treatment, thus reducing the incidence of TB among this high-risk population. So we hope that by 2025, Philippines will no longer be on the list of 10 countries with high number of cases in New York City.
PNA New York works closely with the New York City Department of Health and Mental Hygiene, Bureau of Tuberculosis Control Outreach Unit led by Dr. Barroso. So together, we work in conducting TB screening to Filipinos in NYC. And the TB screening is aimed at increasing awareness about tuberculosis and also increasing perception of risk to TB and motivating care seeking and increasing knowledge about the relevant TB services that the Department of Health offers to the community. We also work closely with Kalusugan Coalition, which is a nonprofit community-based organization. And they help us in terms of spreading the services that's being provided in this mini grant. The New York City Department of Health, we have a long-standing relationship, and this goes back in 2016. We've done a lot of work together in terms of a campaign for TB elimination. We've done health teachings in the communities, churches, and in a matter of fact, Dr. Barroso was once our speaker in our annual conference. And again, with the goal to help eliminate tuberculosis among the Filipino communities. For the Kalusugan Coalition, we've done a lot of projects together. And one of those is the Project ASAP, Asian American Pacific. And that helps to educate the public about the All of Us research project among the Asian American and Pacific Islander communities. And that particular project aims to engage these underrepresented communities in many of the longitudinal studies on precision medicine.
By focusing on foreign-born New Yorkers living in high TB burden neighborhoods, this project seeks to increase knowledge related to TB and TB risk among relevant providers and communities with a high burden of tuberculosis. Reduce also barriers to TB-related and other healthcare services, and to increase TB screening among high-risk individuals, and to ensure medical evaluation and treatment of latent TB infection.